Good evening, everyone. Again, thanks very much for joining us. And my name is Louisa, and tonight I'm also joined by Professor Dale Fisher and Dr. Claire Canning, and we're all from the Center for Infectious Disease Emergencies Response from NUS. So may I get Professor Dale to please introduce himself, although he might not need any introduction.
Thanks, Louisa, and hi everyone. Thanks for joining us. My name's Dale Fisher. I'm an Australian. I've been in Singapore for over 20 years now, since the first SARS outbreak, and done a lot of work with WHO, and was chair of the Global Outbreak Alert and Response Network for 4 years during the pandemic. So, yeah, and I'm chief editor of the book you're going to hear about later. So thanks and welcome.
And Claire, please.
Thank you, Louisa. Good evening, everybody, and welcome to this sharing session. I'm Claire Canning. I've been here in Singapore for 20 years. I'm originally from Ireland. I have a strong background in the last 15 years in medical education. And as part of the team, my role is as the education strategist. So or specialist, so I'm driving the curriculum development aspects of the program, but also I'm a lead for 2 of the courses on the program. So it's a delight to meet you all and welcome to our sharing this evening.
Hey, thanks, Prof. Dale and Claire. And again, I'm Louisa. I'm an ID physician. I shall not reveal how long I've been in Singapore because that would be my age. I'm the Deputy Director of CIDR. And again, welcome everyone to this session. So without further ado, we'll get started on the presentation. So firstly, I think we wanted to just introduce who our Masters of Science in Infectious Disease Emergencies is suitable for. In fact, when we were thinking about this question earlier, it seemed like a simple question, but we did struggle to answer it. It's because of the nature of our course. It's really designed to be suited to a very broad audience and to be suited to a very broad nature of students. So we really want to look for early or mid-career outbreak responders, but you can be coordinators, you can be, for example, epidemiologists, you may work in hospital operations, you may be a researcher, but anyone who has, had experience or come across an outbreak, and of course, everyone has been through COVID. And so and for anyone who really wants to understand more about the end-to-end spectrum of outbreak response and outbreak preparedness and response. And so if you graduate from our course, there will be a really diverse range of roles that you can potentially take on. And we've listed some here, but they are definitely non-exhaustive. And for example, you can have roles in policy making, emergency planning, within government systems, health ministries, within acute healthcare systems. You can step into leadership positions there. And you can also then be prepared for national, regional, or international roles that really require specialized expertise in pandemic preparedness, and also, of course, in the realm of global health security. So, of course, for those of you who are interested in developing your careers in academia, and as I mentioned, research and university, our course definitely gives you an advantage and provides you with further opportunities as well. So Professor Dale will go through the courses that we offer in our master's in a while, but really we're looking for, one of the features that we're looking for in our students is really anyone who is interested to know more about outbreaks. And it's not just from the scientific aspect. You'll find from our course that we really deal with a very broad range of topics, and some things you may not instinctively think about when you're dealing with outbreaks. So I have Prof. Dale introduce further the details of our course.
Yeah, thanks, Louisa. I thought in doing this, it would be good to just give a little bit of history behind this. This is a slide taken at the end of an Ebola outbreak where there were about 400 people over 3 or 4 months that contracted Ebola, 200 plus deaths. And if you look in the middle of that slide, which is obviously a celebration, right in the middle, you can see a notice board, which is enlarged on the right. And this was their strategy. And I say it because I want people to realize how simple it was. And it was just really managing cases, doing lab tests, working with the community, and doing the surveillance and epidemiology to find more cases. And that all had to be coordinated with leaders and logisticians. If we go to the next slide, this is what today looks like more. And I've sort of done it the same way. But you can look at the type of things that weren't in the first one. So right in the middle, it's planning, operational support, as well as coordination, research. You can't manage an outbreak now without looking into the various aspects, whether they be technical or socio-behavioral, without doing research to inform decisions. You can see there's vaccination. Wasn't really spoken of in 2002 or 2001 as a way to control outbreaks. Essential health and social services. You can't manage an outbreak while everyone dies of heart attacks. There's no family planning clinics anymore. Routine vaccinations stop. So how do you do that when there's so much chaos all around you? We didn't really talk much about mental health in the old days, but we know the stress that healthcare workers are under, families are under, the people that have lost their job are under, and this is again another major feature. So if we go to the next slide, we've got 11 courses, of which you have to do 10 to obtain the masters. And these 3 are the compulsory ones. I'm not going to read these out. You can see them on our website. But leadership and coordination, I've seen many examples. I've been to many Ebola flu outbreaks, and I do remember in Liberia in 2014, in September, when it was really at its peak. People were asking, who's in charge? Is the country in charge? Is WHO in charge? Is it a sort of a hybrid of everyone's a bit in charge? So, but imagine that 10 years ago in the biggest outbreak, people were still wondering who's in charge. In surveillance and epidemiology, you'll learn everything from contact tracing to epidemiologic curves, One Health aspects of the approach to medicine. Communications in a crisis, it cannot be underdone. You saw many examples in COVID as where the community wasn't engaged, that actually you can't do anything with all your interventions if the community's not interested. So how do you prepare for that? How do you build the trust? How do you do all that and then amplify it when it happens? Management of misinformation is also another key of this particular course. Next slide. And these are all the other things. Now, these aren't clinical management. This is not going to teach you how to be a clinician, but it will help you understand what they do, how you develop your surge capacity, how you manage and adapt infection prevention and control policies, facility infrastructure. Everyone had to put up tents or find new buildings that they could turn into quarantine centres or isolation rooms, or modify hotels to help out. So how you manage that facility infrastructure as a preparedness effort and as a response effort is covered. All the interventions for outbreak control, we've got experts that are going to tell us how to manage non-pharmaceutical interventions, vaccines, all around vaccines, distribution, equity. How do you use all these tools to control an outbreak and protect people? And as I mentioned earlier, research in a pandemic, there's many different types of research, different ways to do it. And during this course, you'll learn how to prioritize, how to design the question, create the hypothesis, and design the study, and then even take it all the way through to rapid publications and what's the risk of preprints and things like that. So you'll learn a lot about research and teams in that area, how to prepare and how to deliver. Next slide. I mentioned earlier, mental health and support for the vulnerable. There's many vulnerable people during an outbreak, whether it's children, women, disabled, Indigenous, refugees. Lots of people are particularly prone to that vulnerability, but then again, mental health, both for them and for, as I say, those other groups, the healthcare workers, the bereaved, those affected by either the disease or the interventions even. laboratory. We'll talk about the different types of labs, how we manage those, how we pivot them so that they can still do their usual work, but they have to surge as well because they've suddenly got a whole lot of extra tests to do, often novel diagnostics. We'll talk to you about how you assess novel diagnostics and understand the sensitivities, specificities, things like that. And you can't go to an outbreak without being involved in trainings or training of trainers even. You need to use this as a communication method, and we'll teach you how to create learning objectives, design a training course, assess your training course, assess your outcomes, and again, this is another for anyone that's been to the field in an international outbreak or even managed one in your own country. You'll find that this is an essential skill. We're going to look at life in the next one from the pathogens perspective. You know, how do they transmit? How do they behave? What are their clinical features? How do you manage them? So this will be everything you need to know about Ebola, yellow fever, influenza, coronaviruses, MERS, from that perspective. And the last one is for those with a technical leaning, you can actually learn how to model. At a minimum, you'll understand what modeling offers and how to do it. But the lead from that, Professor Alex Cook, is a very experienced modeler, was featured heavily in Singapore during the pandemic and was constantly giving advice to government based on models and assumptions. And you'll learn how those assumptions can greatly affect the belief that you'll get from an intervention. So that's a bit of an overview. Feel free to look at the website and understand more, write in and ask us questions. But that's the content in a nutshell, Louisa.
Okay, thank you so much, Prof. Dale. And as you can see, I hope that you're excited by the very, very enriching content that we have. So I think let me take you just through how to navigate our CIDR website, where you can find a lot of information, more details about our pre-qualifications. I believe that Emily had asked about that, as well as just the application period and also other details such as admission requirements, where you can fill in your forms and such. Okay, so if you can't remember our address, an easy way is just to Google CIDR NUS and we should come up immediately. And also, if you look at here, you can go through our different tabs, but at the top of it is our education page, or also over here, if you can see, you can navigate immediately to the master's degree. So if you go to the education website, you can already see our master's page, and it tells you a little bit about our courses. And if you click here, it will take you to the overview of our course, as well as provide you with the curriculum. This also has a timetable and the schedule Claire will go through in a while. And then you can check out the courses, the core courses, as well as the elective courses that Prof. Dale has just introduced. Now, every master's degree has a study plan. And so if you click on ours, you can see that it will take you through how you can plan out your core courses and your electives for a full-time or part-time student. So I'll leave you to look into those in your own free time. And importantly, these are our admissions criteria. So, however, we do want to say that there is a limited number of points that we can put into on-paper admission requirements, and we do appreciate that there are many students or potential applicants who may have a different degree but practice in the field of public health, or you may have a lot of hands-on and practical experience, and we really do just encourage you to write into us or just to apply, and we will vet through your application. So meaning to say that we may not need to rigidly follow what's only shown on paper here, because as I said, there's a limited number of points that we can put here. But if you're really interested in the program, and especially if you have a lot of hands-on experience, we do take that into merit as well. And for one of you was asking about your admissions documents, or you were having some trouble submitting your applications, this here is the email address that you can remember. It's just cider@nus.edu.sg. Hopefully that's not too difficult to remember. If you have any questions about the program, any technical questions about your application or finances, you can always email into here and our team will respond to you as soon as possible. And so just to go through the rest of the tabs quickly, which are quite self-explanatory, we have our application timeline and all the forms that you need, documents that you need to submit. And there's a checklist that you can use to just check. And you can also find our course fees here. And also just want to bring you, especially for the students, I'm not sure whether anyone is joining us from overseas today, but even for the Singaporean students, we do have some offerings potentially for different forms of scholarships and funding options. So for that as well, you can write into us to ask. Okay, so now on to Claire to take us through a little bit more in detail our schedule for the course.
Thank you, Louisa. So just to give you a brief outline of our teaching and learning schedule, this is a hybrid model of curriculum delivery where we have 2 semesters, and in each semester, we bring the participants together face-to-face in Singapore for 3 full intense weeks. You will be able to see the schedule on the website, which Dr. Louisa alluded to. We then allow the participants, if they're overseas participants, to return to their home country for a period of 8 to 12 weeks, where we will have synchronous but virtual learning activities. Following that, we bring you back towards the end of the semester for another 2 full weeks of face-to-face intensive learning activities. Now, this course can be done full-time, so covering both semesters, or part-time over 1 year, or part-time over 2 years. And I'd just like to touch a little bit on our teaching and learning philosophy and principles. And we really are advocating towards the adult learning approaches. We recognize that you are all specialists. You've already undergone tertiary training. You have context relevant expertise in your disciplines. And we really want to draw on the practices of adult learning, which is the theory and practice of andragogy. And so what I mean by this is a focus on less of the didactic learning. So, but where relevant, we will have didactic lectures, but less focus on a fully didactic teaching and learning approach, and more so on experiential learning, self-directed learning. And we have we're adopting many innovative methods of curriculum design and delivery, which we think is a really unique aspect of our program. So we will have plenty of group work, plenty of storytelling, plenty of networking with your own peers, but also leaders in the field, experts, some simulations-based trainings, some tabletop exercises, debates. I think we have a very rich design and delivery approach. So I think this is very unique to our program. If I can talk to a little bit, if you go to the next slide, please, Louisa. We're hoping, and we're really glad that you can join us this evening, and we hope to know a little bit more about you, if you can share who you are, especially in the feedback later. But we're hoping to attract a very wide mix of disciplines, so professional backgrounds, including, and we already have some applicants signed up, paramedics, junior doctors, some specialist infection prevention nurses, some laboratory researchers, lab technologists, and so on. And this list is not finite. The countries represented so far are rich and diverse, and this is part of our goal to bring you into Singapore to have that face-to-face networking opportunities where you can build your network with the participants that you're learning with, but also build your network with our global experts who are faculty. So far we have applicants from Singapore, Africa, the Middle East, Central America, China, Indonesia, Nepal, Bangladesh, Malaysia, and so on. So really attracting applicants from not only just Southeast Asia, but also the US, the UK, and broader afield into the Middle East. So with that, I will stop unless either Dale or Louisa would like me to expand on anything in terms of our andragogical approach or philosophical approach to teaching and learning, or our candidates. But I look forward to fielding any of your questions, should you have them. And just one last point that, we are adopting an adult learning strategy to teaching. And in line with that, in line with curriculum alignment, our approach to assessment is adult learning focused as well. So not something that I think many of you would be familiar with in terms of more interesting, more real world experience to give you context.
So this is a textbook that I've been putting together for the last 3 years, really. It's got over 100 of my colleagues, which are world experts from all around the world, from all number of organizations, global, national level. There's 39 chapters, so you can imagine if there's 11 courses in the masters that, for instance, vaccines in this has got 2 chapters. One's on the technical side and one's on the sort of distribution and management side. So this is the textbook that is available free online now. You can access it through the website, but you'll also receive a complimentary hard copy when you start the master's course, and this will be like our Bible, if you like, and there'll be lots to reference here. And of course, a lot of the authors have also become our faculty from across the world. I'm very pleased to say that it's just been reviewed in Lancet last week, and it's a glowing report. So I'm particularly excited that this has come to fruition. So I just wanted to share that unlike a lot of master's courses, we actually have the content in place. Now, you might be thinking, oh, I'll just get the book. I won't worry about the master's course. No, they very much complement each other. This will be how to put it into practice, how to really, I guess, bring it to life, if you like. And there's more things in our course as well that obviously can't be done in a book. So I just wanted to point out that. Probably before we can swing to the next slide, Louisa, and I like to highlight this. Hopefully, it's all pretty clear to you. I'll let you read it, but there's these 5 program features. I hope I've already demonstrated that the content is really holistic. You can't come to this course and become a microbiologist or a doctor or something like that, but you will understand how to prepare for an outbreak or a pandemic and how to respond to it and be a valuable person in whatever organization you're in. But interestingly, we've got these cross-cutting threads, and some of you may have already noticed, how come you're not talking about the ethical situation in any of these? How come you're not talking about the legal frameworks, which are critical enablers of so many of these pillars? And these sort of threads we're actually not turning into actual courses, but they're going to cut across all the courses. So their ethics, their legal frameworks, the role of the police and the role of the armed forces, who really do appear in so many of the courses, even though you may not notice because they do it subtly. And the other thing that comes up in each course will be the future. What technology, what's going to happen in the next 5 or 10 years to revolutionize this aspect or this particular pillar. So I guess that's one of my favorite bits, but I was wondering, perhaps Louisa, what are your favorite bits of the course?
Yeah, so I will jump into something that's also shown here that we haven't really touched on, and that's the part about building your network. So as Claire has alluded to, our current applicants and hopefully our student cohort will be a really diverse range of individuals, not only in their job roles, but also the countries that you're from. And we already have a number of applicants from within Southeast Asia, and we're also looking to applicants from the Middle East, even from Europe, as well as from Africa. So this really tells you that, you know, amongst your classmates, you will you'll be able to interact with a very diverse range of individuals. And, you know, through there, I think the master's course is really a very, very precious platform that you can use to build your own networks in, you know, outbreak management and outbreak response in future. Because as we already know, outbreaks really don't respect any borders. A lot of the times as well, in your management, or even when you're in the information gathering stage in the early phases, you need to be able to rely on a colleague that you have in different parts of your region, different parts of the world, even to understand what's going on and to piece together what's going on. And you'll be able to share your knowledge, your information, as well as your experiences. So I think that's a particular strong point of our program as well, because of the nature of the topic that we're dealing with, and also because our learners themselves will be able to then build these very strong networks that you'll be able to carry with you into your careers in the future.
Okay. Claire, you're not allowed to say adult learning styles, but what's your favorite bit of the course?
Well, it has to be our diverse faculty. I'm honored to have made new colleagues both locally and internationally. We have a vast faculty list of experts in their field who have needed no coercion at all from us. They have just been super excited to jump on board, contribute their areas of expertise, and delve deep into our curriculum. So if I can just for a moment acknowledge some of the local experts that we have in Singapore, in the hospitals, in the School of Public Health, we have colleagues from the ethics department, from legal internationally. We have currently 2 visiting professors this week with us, one from Geneva and one from Sydney. And if we look at the experts internationally that have joined very willingly our program, we have global experts from Papua New Guinea, from the US, from Switzerland, from the United Kingdom, from Australia, from South Korea, Hong Kong, Nepal. I mean, we really have attracted, on the back of your baby, Dale, the book, attracted just an enormous amount of experts. And I think this really puts us in a position that stands out from other master's degree programs. So it's the honor and joy of working with these faculty. Dale, you mentioned that we have, legal and ethics as our cross-cutting themes. We have people from the military and the Navy. I think we really stand out from a very strong faculty perspective. And another thing that I just might like to add, which is related to our diverse faculty. One of our goals as the core team is to provide you as participants with local mentors. So a mentor in your country, in your region that, you can always draw upon. If you have a task that we set you and you think, oh, I'm not really sure about how to go about modeling, or who talk to the government, or who's the surveillance person that I need to speak to, we will link you up with those mentors that will guide you in your own context when you're off-site from Singapore.
Yeah, just to elaborate on that. What Claire's alluding to is that middle section when you're not necessarily have to be in Singapore if you're an overseas person, or indeed if you're in Singapore as a Singaporean, that you will have some tasks to do, and that could be, analyze your own Infectious Disease Act. We don't want this to be completely Singapore-centric. We want to give an opportunity for people outside of Singapore, back in their own country, to work with their mentor to understand what we were talking about and how that applies to their own country. So yeah, I think that's another strength too. I think, well, I hand back to you, Louisa, to consider if there's any outstanding questions or things like that.
If there is a question, please use the Q&A window.
There's one question appeared in the chat. Will there be opportunities for field work? I think we'll certainly be doing excursions, but I think actual doing the work won't be provided by us. It's you'll have tasks, but no, we won't be sending you along to the Ministry of Health to have a work experience. But you'll be certainly well enough equipped afterwards to apply for a job there, although I think there's some people from there already applying for our course. Yeah, so field trips, yes, but not actually work. This is a learning and consolidating year, I think. Is that fair from you, team?
So this is a coursework-based master's, yeah. So at the moment, because of the already very open and kind of interactive way that we're learning, we're not planning on top of that any more capstone projects, as some people may be familiar with, because there's plenty of opportunity to already do the group work and to have those discussions during throughout the course.
But throughout the course, there will be a lot of hands-on activity.
Yeah.
So as Dr. Louisa said, not necessarily a capstone project, but there will be plenty of opportunities for you to do some hands-on work and gain expertise.
So we have another question in the Q&A. Could you give us some examples of the kinds of roles that you could take on after this course? So as I mentioned in the beginning, really because if you think of the type of work that our students may be doing or the kind of career trajectories that you may be thinking about in this very, very broad realm of outbreak preparedness and response, you could be working, as Dale already mentioned, you could be working in Ministry of Health, in Ministries of Health, you can be working in other governmental health agencies. I mean, you can be thinking of any national, international health agencies as well. You know, I won't mention any particular names, that we all know the big ones internationally. And it also depends on your job role. You could be an epidemiologist, you could be a hospital operations, you could be in hospital management, you could be a researcher as well, or in academia. So our master's is really suited towards a very wide range of job roles, of students who are already in different job roles, who already have different experiences. And also then the jobs that you can take on after that are also very diverse.
Yeah, I'd also make the point that in being good at this sort of work, of course, most of the time we're not in a pandemic, but coming to this course, if in doing leadership and surveillance and epidemiology and communications and understanding laboratory and surge capacity and hospital design, you're really well equipped to do all the work that's needed outside of pandemics as well. So while our focus is on that, we're fully aware that TB and malaria and things like that are bigger problems in many countries, dengue, but and we really believe that this course will help you be better at managing those sort of problems and preparing for those problems as well. So I hope that answers the question. How big an intake are you looking at? It's we don't know. It's the first time we've done it. We're sort of thinking that the number will be around 50 to 70, something like that. I think once we get above that number, we'll be very discerning, because you start to lose the learning experience if there's over 100 people in the room, for instance. So that's probably when we'd stop saying yes to people so freely. We've already got enough people that we will definitely run the course. There's plenty. You saw from the list of people that are either registered or signed up that it's full steam ahead. But ultimately we'd be looking at 50 to 70. I think it'd be a nice number. It's big emphasis on group work. it's not, I don't think at any stage will you be sitting in a lecture style setup. It'll be maybe groups of 6 where there could be a didactic lecture, but then we'll follow that up with some group work where you work within your group to complete some tasks and then feedback to the whole group. So it'll be very interactive in that respect.
And I'll just segue there that there is a question specifically on the types of hands-on work we can be expecting during the lessons. So could I get Claire to answer this?
Yes, so I think you will be putting into practice methodologies such as learning how to model, appreciating the benefit and the power of modeling, surveillance and epidemiology, contact tracing, looking at deep sequencing, interpreting data. So whilst we don't expect you to come away as an expert in any of those disciplines, we do want you to have a very much hands-on flavor to that, to those different types of disciplines. The classroom size, as Prof. Dale alluded to, will be somewhere between 50 and 70, and we will have enough technical expertise and facilitators to walk you through some of these challenges. A lot of the teaching and learning will be, in the classroom, but then building up on this as you go remotely to back to your home countries, and we build upon things further and then bring you back to the classroom to consolidate these, especially the hands-on experiences. So I hope that answers that question. I know that there's another question somewhat related, which is for the part-time course, can I know the face-to-face or the online classes will be conducted in the evening time? As I mentioned, the schedule is just in the background there. For both semesters, the first 3 weeks of the schedule are intense face-to-face, in person in Singapore, regardless of whether you are full-time or part-time, and depending on the electives you're taking and the core modules you're taking. For the intermediate, in between the 2 face-to-face sessions, those are synchronous sessions. All participants will be online at the same time with our faculty, and these will be held in the evening time, Singapore time. And obviously, we're trying to accommodate our varied international participants and their time zones. So we hope that you, as you return to your country, can go back to normal work situations, normal family situations. We will endeavor to have those times in the evening to suit that and accommodate that.
So just to add on, depending, you said there was 3 weeks full on face-to-face, but if you're only doing like 3 of the 5 courses, then obviously you won't have to be there every day, every hour. You're there for the courses you do. So it'll probably be sort of half time in the face-to-face because you're doing it over 2 years.
Yep.
I'd probably suggest if someone wants, it might even be worth a personal conversation for someone that wants to do it part-time, just to help them sort of understand the pathway.
Yeah, so the part-time master's degree can be done over a period of 2 years. We do, as Dale walked you through the courses, have 3 core courses and 8 electives, of which you choose 7. So it's just a combination of which you choose and when you would be online and face-to-face with us. But I think that's a really good idea, Dale. If anybody would like to get in touch with us, Louisa has given you the website address to email us. So yeah, a personalized discussion would probably be beneficial.
Yeah, speaking of, we have a really excellent administration support team. And really, if you have any specific questions, I know some of you have been asking about the application processes, whether you're eligible, whether you're eligible for scholarships, or even just the nature and details of the scholarships. Please do email us, because we will be able to assist you one-on-one. And sometimes we do need to review your application and to be able to offer you the best advice. let me again reiterate that our email address is cider@nus.edu.sg, and you can always email us as well if you do have any questions on our masters. And I will also be showing you 2 QR codes later that you'll be able to use in case you've not really, you don't know how to navigate the website. You can take a screenshot of that as well. And that will also take you directly to our website and have more information on the application process. So I'll leave the screen here and everybody can take a screenshot. All right, thank you very much for your time and joining us this evening. We hope that was informative, that you've learned more about the course, and more importantly, that you're now ready to apply for the course.
Bye.
Hi, thanks everyone.
Good night, everybody.